We're following new COVID vaccine guidance from the FDA. If you're severely immunocompromised and already received 2 doses of the Moderna or Pfizer vaccines, you're now eligible for a 3rd dose. But what about everyone else? As Dana Smith reports, health leaders say they're not ruling out the possibility of a 3rd shot for everyone.
As COVID cases skyrocket across the U.S., we've reached another phase in the country's vaccine rollout. A 3rd dose of the Pfizer or Moderna vaccines. This recommendation from the FDA is only for people with severely compromised immune systems, after new data showed the standard 2 doses of the mRNA vaccine were not enough. Dr. Param Jabari of the Virginia Department of Health said that could change for everyone else.
I think the possibility exists. We know, for a fact that with time, the immunity that vaccines give us decrease.
Research shows the vaccines are effective against the Delta variant. But if the virus continues to mutate, that's something health experts will have to keep an eye on.
We see that this virus is changing, right? We've got different variants, different strains, and there's some considerations as to whether the vaccines will remain effective against new strains.
Dr. Jabari said a universal recommendation for a 3rd dose of the Moderna or Pfizer vaccine isn't out of the question, even if it's not on the table right now.
Whether we're actually creating a new vaccine for COVID, as we do with flu every year, where we look at different strains, or is it another shot to complete an initial series?
Health experts are monitoring the immunity the vaccines give us to see if the strength goes down over time. Dana Smith, 13 News Now.
If you're eligible for a 3rd dose of the COVID-19 vaccine, you can get it at a vaccine clinic or a pharmacy, but Dr. Jabari recommends you speak with your doctor who is more familiar with your medical history.